Good. Well, with all the technicalities now having been set up, welcome everybody to our webinar on COVID-19 and measures that on-site agricultural supply chain and forestry companies can take to support their workers and reduce the spread of this virus. Of course, when we were setting up this webinar, we were looking for possibilities and opportunities to support you, our partner companies, in this uncertain period. We pulled together this webinar very quickly, within a week's time. Invitations only went out last Monday evening. And I think we can confidently say that it responds to a need for information at this uncertain time, as we received over 650 people registering for the webinar, and currently almost have already 300 people online. As again said, maybe starting with housekeeping communication, please switch off your video. You will also remain on mute as participants during this webinar. Unfortunately, we have so many people joining that it will be difficult for allowing other people to speak besides the speakers that we have invited. As again said, these are uncertain times for many, and we're extremely thankful to the speakers for their willingness to join us in this effort of spreading credible and actionable information with our partners. And with that, I'd like to pass the floor to Gauthier Keru, our co-host, my co-host in this webinar, who's speaking on behalf of Mirova.
Yes, hello everyone. I'll be very brief because we are here to listen to the speakers. But yes, in these difficult times, we thought it would be useful to contribute to the crisis management and share information and knowledge. And we need to find really collective action and answers. And each of us has a part to play. So IDH and Mirova were committed to this through our respective activity. And Mirova, as a responsible investment company, is really willing to mobilize the financial sector as a tool to help overcome this crisis and transform our economies. So the objective here of the seminar is really to take stock of the situation re COVID-19 for agriculture, forestry companies, as well as operators involved in broader landscape management, and discuss practical solutions as well with lessons learned from other crises, in particular from Ebola crisis in West Africa. So thank you very much for all the participants and the speakers, and we are really looking forward to useful exchanges. Thank you very much.
Very good. With that, I'd like to pass on the word to our first speaker. This is Mr. David Nabarro, Special Envoy. No, I'll first start with the agenda. Yeah, so the agenda of the call is in 4 sessions. In the first session, we'll have speaker Mr. David Nabarro from the WHO, Special Envoy for the Private Sector and on COVID-19. After that, Maximo Torero-Cullen will speak. He's Chief Economist of the FAO. As a third block, we will have Matt Karinen, David Rothschild, and Vicky Ponudarai contribute experiences from managing a company through Ebola times in Liberia. And finally, we have 2 companies from the private sector briefly reflect on how they're currently coping with the COVID-19 situation. And at the end, we'll close with a poll, also looking for your input and feedback, and have some final closing words. It's good to be aware that after each presentation, which will last for about 10 minutes, there will be 10 minutes of room for question and answers. Please submit your questions through the chat function, and we will be online to look at those, and we'll harvest out of the chat function to ask questions to the speakers. So I hope that this is all clear. Well, all that being said, I would like to announce our first guest today. We're very grateful to have Mr. David Nabarro, Special Envoy for the World Health Organization and Director General on COVID-19. David earlier was Special Envoy for the UN Secretary General on Ebola during 1914-1915, and also has 40 years of experience in international public health as a community-based practitioner, as an educator, as a public servant, director, as well as diplomat. David, with this, I would like to pass on the word for you, and thank you again for making time in your schedule to join us today.
Thank you very much indeed, Ninka, and good day to everybody. I've got, I think, 10 minutes now in which I can make some opening remarks. I may not be able to stay on for the full duration of the webinar because this is a particularly challenging time, and I seem to be rather busy. As you heard, I've been involved in outbreaks of various kinds over the years, but really this particular pandemic is quite a lot bigger than anything I've ever been involved in before. And just at the moment, we don't fully know where it's going to lead to. So what I'm going to say is a stock take of where I believe we are now, but also a bit of a foresight into where things might go. So we've only known about this coronavirus, COVID-19, for about 4 months, and we're learning about it all the time. And we know that it's capable of advancing very rapidly. It basically accelerates when we look at individual outbreaks as they grow at the rate of doubling about every 2.5 days if we don't take action to slow it down. And although that perhaps doesn't sound too much when we just talk about it, those of you who are interested in exponential growth will realize that something that doubles in size every 2.5 days increases 8 times in a week, and as many as 1,000 times in magnitude every month. So in responding to the outbreaks as they appear in any community, as a new individual comes in and starts to transmit the disease, there is one thing that we've learned from experiences, particularly in Southeast Asia, and that is when an outbreak starts, you have to move very, very quickly to contain it. Any delay can lead to a really massive problem. And as we've seen from some settings, particularly in Europe and North America, where the intensity of response was slow because of various factors, and in fact, really only built up over a period of about 3 weeks. During that time, the virus moves through communities and turns into an extraordinary explosive outbreak, which has really massive consequences for people, for their health services, and for society. And there's really only one way to contain outbreaks when they start, and that is to interrupt transmission by isolating people with symptoms of the disease and making sure they are not in contact with anybody else for the duration, usually 14 days, of their infectivity. And we really have to move quickly also because people are most infectious at the beginning of the illness. For many, it's a quite trivial illness. You know, they really just feel a bit of a fever, a cough, and then shortness of breath. And it feels like a sort of bad flu. But it's much worse than that for older people or people with other diseases. And in fact, it does tend to lead to very high levels of death, particularly among those at the latter part of their lives. And so that's why we really are doing our best to contain outbreaks when they start. Otherwise, hospitals get overloaded and societies are particularly traumatized. Interrupting transmission at the beginning when an outbreak starts up, when there are a few chains of transmission, so responding to an alert really quickly is great because it means then that rest of society can go on with living in a pretty normal way. And we've seen how in Singapore and in South Korea, this capacity to respond quickly is being deployed all over the countries and to good effect. And the same in China, where now the whole country is on alert for new cases arriving and rapid response takes place. But what happens if you don't quite get there in time and the outbreak builds up, like we're seeing in New York or we've seen in northern Italy recently? The answer then is that you are in a really quite tricky situation and you have to reduce the opportunities for people to have any contact with each other. And that means asking the whole of society to maintain this important figure of 2 meters distance from each other. And you do that either by asking people to stay away from each other through instructions, or if they won't do that, through actually imposing what's called a lockdown. There are now lockdowns in place in 70 countries and territories throughout the world. Somewhere in the region of nearly 3 billion people are living under conditions of lockdown of various kinds. Different countries do their lockdowns in different ways, usually trying to ensure that essential workers, particularly in the food sector, are able to work, as well as, of course, health workers, who are the most important of all. They're in the front line in this response. But of course, a lockdown has enormous social, economic, and security consequences. Socially, it disturbs social fabric. Economic means particularly low-paid people are unable to get the cash they need to live. And of course, small businesses are going bankrupt all over the place, and large companies in certain sectors are in real difficulty. So nobody wants to have a lockdown in place for too long. Several countries have imposed lockdowns early on in their fight against the disease, particularly countries that don't have strong health services and where the social fabric perhaps is, although it's strong, is still not necessarily tuned to dealing with a challenge like this. And so in those cases, we really are encouraging, when a lockdown is imposed, strenuous efforts are put in place to help communities defend themselves against the arrival of the virus and able to mount really robust responses quickly, and trying to make sure that hospital services are working and health workers are protected, trying to make sure that food systems are not interrupted. But of course, the imposition of these early lockdowns, this is happening in India right now, or in Kenya, South Africa, Chile, those too have major consequences with confused populations. And often the instructions for how to do the lockdown are not fully disseminated throughout society, and that can lead to some societal unrest. Now, if I was in a company right now, I would be focusing very much on my workforce, because they do need to be reassured and kept safe. If wherever possible, they need to have enough income so that the employees can buy their food they need, buy the food they need, or go about the basics of their life. And we're seeing in so many geographies that poorer people are actually suffering very badly. I'd also be really looking at my supply chains and trying to ensure that they are robust and that they have continuity built in. And I'd be recognizing that there's going to be some time before markets open up fully. And so there are going to be disturbances to trade. I'd be talking to my bankers and checking to see that I have access to credit so that I'm not going to be in any real difficulty as a result of the economic challenges with disturbance to my business. I think that what we do have to remember is that this is not going to go away. This virus is going to stay with us. We keep hoping that there will be a vaccine, but it's likely to be 18 months before it's available. It may even be longer. So we're saying actually all societies, after we've been through the current explosive outbreaks, are going to have to be ready to defend themselves against COVID. And that means, and it will mean, I think, a lot of trying to ensure that all people everywhere have got robust public health services in place. I think companies will need to work closely with their governments to make sure that the capacity to detect and identify people with the disease is actually everywhere and is performed in a robust and also dignified way, so that people's human rights are protected. So I think there's a role for businesses, all businesses, in making certain that their employees understand what's going on and why, and are able to comply with any regulations that are imposed, even if at first sight they appear to be quite strenuous, particularly when it comes to restrictions on movements of people from places where there's a lot of COVID being transmitted to places where it's not, because societies will want to keep themselves safe. And I think that perhaps last point, this does remind us of the importance of basic public health services in communities everywhere. And it does remind us of the importance of communities being organized so that they can deal with this kind of threat. It will challenge us a lot as the coming months and years come towards us. We won't be able to do this work without working together in solidarity. I'd just like to finish now with a word to younger people everywhere. You know, all young people must be wondering, what on earth is going on? What is this new terrible threat that we're encountering? And how do we deal with this? And I would like to say that it will be young people everywhere who will be the most important in spreading the word about the importance of being respectful of the virus and defending against it. So that was my little bell telling me that I've done my 10 minutes. I'll be here now to answer questions. And if you want to stay in touch with me afterwards, I do write my reflections that come out of webinars like this into narratives that I put onto my website, and I will make certain that I put the access on the chat line. Thanks very much indeed, and back to you.
Thank you very much, David, for those words. And indeed, let's now move to questions and answers that are coming in through the chat function. One of the first questions that come in are related to population and youth, especially in many African countries. There are many young people. Is there already information on the relationship between a young population and the impact of Corona?
Okay. Yeah. No, so let me just give you just tiny bits of information here. That in the big Chinese outbreaks and also in outbreaks in Europe and North America, it does seem as though young people as well as older people can get the disease, but usually young people are not so badly affected. And so that's really good news. In fact, my daughter, who's 22, she's just recovering from COVID, we believe. She wasn't tested. But the important thing to say is that young people can still carry the virus and give it to older people in their communities. And the older people are the ones who are likely to die. So we're saying to young people, be joyful that probably you're not going to be badly affected if you get the disease, but be super careful not, if you've got symptoms, not to go close to older people and infect them, because that can be a major disadvantage. Secondly, we say to young people, in your community, please make sure that you know who is where and do what you can to support them. Support the older ones who will be quite fearful for their well-being. Obviously, don't get too close to them, but make sure they've got food. Make sure that they're not isolated. Sometimes the word social isolation is used to describe the kind of distancing, or social distancing is used to describe the kind of distance we need to keep apart from each other. I prefer talking about physical distancing, because the last thing that I want to happen is that as a result of this outbreak, older people and vulnerable people are actually isolated. They need to be socially connected, but with physical distance. Thank you.
Thank you very much. Then other questions that come up are much related to the role of the private sector in this. So, for example, within WHO, is there already thinking on how big companies can play a role, how small and medium enterprises can play a role, how can they support each other?
Thank you very much indeed. Let's just look at the really powerful role that private sector companies can play. First of all, we must remember that a business, perhaps even more than a national leader, is looking to the medium long term all the time. How can I maintain my business, maintain my loyalty of my customers? How can I maintain the markets where I'm selling my produce and not have it all dented or perhaps damaged as a result of the pandemic or the control measures? Businesses do have an awful lot of trust among their employees and among the members of the communities where they work. And if businesses can combine with the scientific guidance that comes from the World Health Organization and constantly be explaining what's going on to their employees through regular briefing, with a lot of opportunity for question and answer to do with fears and anxieties. Businesses can communicate with their customers through their products. They can put messages onto product wrapping. They can include messages within their publicity. I've just been doing an interview with a company, with a television station in India, and I was very impressed in the time before I did the interview that a company had given up some of the time in its advertising for a famous Indian actor to be sharing messages about what individuals can do protect themselves against COVID. So through every kind of contact you have with your customers, whether it's through advertising or through labeling, you can do so much. Businesses can do a lot also to make sure that any market failures are addressed, particularly if there appears to be withholding of stock or any efforts to try to push up prices. That's totally unacceptable as far as I'm concerned, though it's rational. And so I'm asking businesses everywhere to come together in a way that's hitherto kind of not been happening, so that even in the competitive space, they're working to try to ensure that that they are maintaining supplies of essential goods and keeping people kind of aware that they are being looked after. So businesses are important in communication, businesses are important through their employees in contributing the response, and businesses are vital for maintaining continuity of what people need to get on with their daily lives. Just one word, small and medium enterprises, as well as people on individuals on daily wages, are particularly badly hit. The small and medium enterprises are in danger of bankruptcy, and many of them are not able to access any kind of special finance to keep them afloat. We need to look out for the SMEs. We need to protect them wherever possible, and we need to enable them to continue to thrive. And we must make sure that people on daily wages are not in such a position that they are going to go hungry because they can't buy food or other essentials.
Thank you very much, David. As time is apparently, of course, already running short, we have only room for one more question. I'm going to try and combine a number of things that have come up.
Thank you.
And this is especially around implementation in the workplace. So there are questions around challenges related to implementing physical distancing in operations, questions related to the use or usefulness of wearing masks. Could you quickly reflect on those?
I think that we are still in a situation where we are saying, in the midst of an intense outbreak, you really must maintain physical distance. And this does make it very, very difficult for industries where close proximity is necessary for the full fulfillment of functions, such as the travel sector, such as the hospitality sector, to continue working. And there are challenges also in many of the businesses represented on this call, because people do have to be close together. So what can we do? Well, it does appear that having a mask reduces the likelihood that if you've got the disease, you are transmitting it to others. And so I would suggest that anybody who's sick should not be at work. They should be isolating themselves. But if for any reason they have to be in contact with others, do wear a mask, do practice very, very good cough hygiene, do wash your hands regularly. Try to remember that you've got something that could cause serious illness or even death to other people. And then, should people wear masks in the sort of normal conduct of life? There's a big debate on that, and there's increasing pressure really for more and more people to wear masks as they go about their daily business. But then what happens? You just end up with shortage of masks for people who really need them, like health workers or people working in essential services. And so I, for example, am not wearing a mask as I walk around normally. I'm just keeping away 2 meters away from people. And I think that, so emphasis on physical distancing, emphasis on hygiene at all times. And if you really have to be in contact with other people, it's worth really seriously thinking about wearing a mask, just because you never know whether other people are infected.
Thanks very much, David. And I think with that, we want to thank you very much for making time in your busy schedule for joining us and sharing your expertise with this audience.
Thank you. I'll stay on until I have to go. Thank you very much indeed. And
Thanks. Please
stay in touch. I put my website onto the chat line, and there's a contact thing through that anybody can use. Thanks again. Thanks
very much. With that, I would like to pass the word on to Gauthier Caru, who will announce our next speaker.
Yes, thank you very much. Hope you can still hear me well. So next speaker will be Maximo Torero, who is Chief Economist of the UN Food and Agriculture Organization. Massimo will help us understand the implication of COVID-19 for agriculture and food supply chain at global level, especially from a macroeconomic point of view, and he will in particular explain how health issues and lockdowns can affect the agriculture and plantation activity and how this can be mitigated. So Maximo, the floor is yours.
Thank you very much. I don't know if you can upload my presentation or... Okay, great. Okay, so thank you very much. Thank you, David, very much for what you said. Extremely important because the top priority is health, and that's something that we need to carefully look at. My concern, and as you know, is on food, and we believe is the second thing in line, which could be extremely important that we need to keep priority. So what we know today, and please pass next slide. So first, we know that the supply chain is a complex structure. This graph oversimplifies the complexity of a supply chain. But there are many actors, many players, and every sector is different within the food supply chain. And that's a little bit what I would like to explain today. So we move in two extreme worlds in terms of food. One is a staple world, and the other one is what we call the high value commodity world. In the staple world, that means cereals, wheat, maize, corn, rice, soybeans. The situation today in terms of production is pretty good. We have sufficient supplies. We have sufficient stocks, as I will show. And it's a capital intensive industry for the key exporting countries. So it's basically capital intensive. So the labor issue is not such of a problem, like in terms of labor supply, meaning workers that could have health issues or workers that cannot go because of the lockdowns, because most of it is managed by machines. So the idea there is to go back, please. The idea there will be to focus more on the supply, on the logistical part. That's where the complexity could come. But if we give correct signals that the logistical problems because of the lockdowns of the transportation of the cereals to the ports are okay, then the market will come down because we have sufficient food available. The high value world, which is basically fresh fruits and vegetables, meat, fish, that's a more complex sector because it's very labor intensive. So all the issues of labor matter here. The health of the labor matter, the intensity of labor availability, the labor supply, which is being reduced because of the lockdowns. Not only that, it's a sector that the logistical part is a lot more sensitive because it's perishable. So if the product doesn't move fast, then it will be deteriorated in the process. So this sector is different, and we need to look at it very carefully. Even if you go to a processing plant of food, the lanes of production, you will see how much the distance that David was talking of 2 meters between workers is impossible. They are one after the other. So there is a huge logistical transformation that we need to put in place there to be able to keep working in terms of the fresh fruits and vegetable supply chain. Next, please. So what we have done, so we are trying to look at the different channels of transmission. And essentially, we have a demand and a supply shock. We are facing two shocks today in the world, and that's what we need to look carefully. On the supply side, the major shocks, and if you move to the next, I think there I have. Okay, so on the supply shock, you will see that there are intermediate inputs which are being affected. This is the supply of fertilizers, pesticides, and so on. But there is also a significant effect on the labor intensity of production, which especially will affect the potential high-value commodity world. Also, we have other channels which are linked more to macroeconomic issues. Energy, one, exchange rates, which is really important, and I will explain why. But we need to look at those carefully because any devaluation of the exchange rate that we are observing today change a little bit the terms of exchange, and that will create behaviors of exporting companies which not necessarily will satisfy the local demand. Then we have the problem of trade, which is one of the problems that we are looking very carefully, because there is no need in the staple world where this is starting to happen to put any export barrier, any export restriction, any export ban, because as I explained, in the staple world, we have enough food available. So we need to be very careful, and on the contrary, calm markets by showing how the logistic part is being resolved. But then we have what I call number 4 here, the demand problem. And the demand problem, of course, is starting to happen, especially in the fresh fruits and vegetables in fishery, because of the closures of restaurants and closure of all these services that we were providing before. And that is affecting substantially the demand today of the food. But it will keep going because as we move out of the process, there will be an economic recession. And that's where we need to be careful because the demand will go down and that means prices will go down. Now, in all these channels, there are these arrows. And for us, these arrows are logistical parts. And this is where we also need to put a lot of importance because we need to resolve the logistical problem so that we can find solutions within keeping the healthy measures, the health measures that David was mentioning alive. That's crucial to have them alive so that we are able to keep operating. But the supply chain for us is something that needs to be taken very carefully. Next, please. Now, on the supply side, as I mentioned, we will find less production likely, especially in the high-value commodities. We are starting to observe this. Why? Because lack of labor, because the logistical part in the high-value commodities is still not aligned. We are seeing countries that have to destroy produce. There are sectors like flowers, for example, which don't have a market anymore, don't have way of transportation. Flowers are transporting by air, and that is substantially being affected. That means a problem in the labor force, and that's where the government is to help these sectors. In fresh fruits, for example, we are observing problems in many countries, even in California, in Peru, for example, because many of the European countries are starting to give more importance in fresh fruits and vegetables to their local producers, because that's the way for them to protect the local producers, which is okay. But that doesn't mean at all that you have to restrict the trade flow, okay? But for that trade flow to work, we need to resolve the logistical problem. Now, our major concern is that the effects of these logistical problems could be reflected in April and May. Now, as long as we can resolve the logistical problems, then we'll be okay. And what this means, most of the transportation is capital intensive. So it means that we need to put mechanisms in place to assure that those sectors keep operating, but respecting the physical distance, wearing masks, wearing gloves, and especially testing. And if something we can do with Africa right now, which is the continent which we are mostly concerned because it's the continent where most of the food insecurity is today, where the highest levels of poverty are, where the most food crises are, is that we need to supply them as much testing as we can so that they can make all these things to work properly, and they can avoid the levels of spread of this pandemic that we're observing in other places of the world. So for us, is how we can help on the supply side these countries. And one way we're trying to do it is looking at the crop calendars, for example, and trying to see where are we in each of the commodities in these countries in terms of the crop calendars, because that will help us to identify what we can do if there is still time to do harvest quickly, and then finding mechanisms with private sector or others to collect that produce so that they don't lose their harvest. And the same on the planting for next year. If we still can deploy farmers to plant, and then they can go in the lockdown, that would be great. But again, the first priority is health. So if we cannot do this conserving the health measures that David clearly mentioned, then it will be very complicated to do it, and it will be not advisable. But we need to think carefully how we can strategize so that we can increase our efficiencies. The next, please. The demand side, again, has several dimensions, okay? Normally, food is inelastic, but normally what we observe in this type of situations is that people start to switch to different types of foods. And that's where we are worried because of potential increase in consumption of calories, which could end in problems of obesity and overweight. But the other problem is that people could, because of uncertainty, could start hoarding more food and could start buying excessive food. And that's another risk because it could create significant waste. On the supply side, we could have losses, which means from the producer side up to the wholesaler because of the logistical part. But then on the demand side, we could have significant waste if we are not careful. So I think messages here are more to keep the count, and you don't need to purchase. I am in Italy today and there is no scarcity and people don't buy enormous quantities. So I think we need to learn from what is happening in other countries and trying to find a solution to that. The other issue, which is important on the demand side, is how we can lower the distance so that food can be procured closer. And that's what many countries are doing. Next, please. Okay, this is the issue of the devaluation. This is up to updated until April 2nd. Look at the rate of devaluation, which is in red. Almost all commodities have substantial devaluation. That means for an exporter, it's very profitable to export whatever they have. And that's a concern of many countries. That's why, for example, Russia decided to put a quota. Now, the smart move was that the quota is big enough that it basically replicates what the country was exporting already. So it doesn't distort the market. But at the same time assures that part of the commodity stays in the country so that they can supply their meals and they can have the wheat they need. So that's a good move because we are not distorting the trade, but we are also not allowing all the exporters to sell everything because of the gains in exchange rate, which in this case, the country needs also part of the wheat. So I think if these messages are transferred, that could help enormously. Also, we are observing countries which are getting nervous, like in the case of Vietnam, which they decided to stop exports until the 15th of April, basically to assess what they have. And we hope, because they have a good harvest and good stocks, that they will open after that. But this exchange rate is a big issue that we need to look at carefully because it's creating a lot of incentives for exports. Next, please. And this is just to show you that the stocks are pretty good. If we compare to 2007, 2008, we are completely better than that situation. So the problem we are living today in terms of food availability is not what we have in 2007 and 2008. The supplies are there in staple commodities. We don't have the same problem. Therefore, we shouldn't bring a crisis where there is not a crisis. What we should do is resolve the logistical problems and give the signal to the market that those logistical problems are being resolved, so therefore markets come down. Next, please. And this is just to show the prices. Most of the prices are going down. Even wheat now is going down after what the US mentioned in terms of the harvest. Next, please. This is to show maize and maize futures. Next. And this is the prices of soybeans, also significantly going down. Next. And here we are seeing export prices of rice. Rice is very sensitive because a thin market, and the measures like the one of Vietnam created some uncertainty, which created an increase. And here we need to be careful. If we recall in 2007 and 8, rice was the first one to create excessive spikes of prices and volatility. So we need to try to avoid that by informing markets that there are sufficient stocks. Next, please. Now, what we should do, and we have designed our strategy in different priorities. The first one is most vulnerable populations. That's crucial because those are the people that are in the emergency and need assistance. One of the major problems is the school feeding programs. Most of the countries have closed their schools because of the lockdown. And there were millions of kids that were accessing food through those schools. And we need to find a solution to that, because if not, they will be facing severe problems. In many cases, this was the only meal they used to get. Now, we, in the FAO website, you will see that we have documented all the practices that can resolve this, and we have also produced a brief, like creating alternative mechanisms. For example, using food banks, using NGOs to distribute the food so that at least the kids that were going to school still receive that, because also helps the farmers that were supplying that food for the school feeding programs. We need to have all the programs of safety nets in place, and we need to be very careful because programs that were conditional on education and on health no longer will have the conditionality, so we need to remove them. We need to target programs like Pension 65 of Peru, for example, that is targeting older generations, older cohorts of population, because that will help them, which are very vulnerable under this disease, to be able to help them. And we also need to find ways to scale up the nutrition programs and through information to inform people of the problems that they are facing. So basically here, what I am listing is all the different mechanisms that we have in our battery of tools that we have learned over time. And for each of them, you can find significant best practices on what countries are doing so that we can minimize the potential effects over the most vulnerable populations. And this is what we need to live for and to bring to Africa to avoid their facing the problems that initially developed countries even has faced, so that these systems are in place and they can minimize the potential consequences of the pandemic. Next, please. Another important thing is to look at small farmers. Why? Because small farmers normally will sell their produce in local markets. If they are locked down, they won't be able to reach those local markets and they won't be able to sell. And that's a concern to them. So here we need to find ways to help them through safety nets, but also, and what we have learned from China and from other continents, is that there are ways in which we can reduce the intensity of mobility by increasing the collection centers. So this could be a great opportunity to put in place a system like the warehouse receipt system, for example. Warehouses could help for collection of the food that could be harvested right now, and that will allow to be able to help smallholders to deliver their produce. And of course, the collector centers will assume a cost under these conditions. But I think it will be a good investment of aid money right now to set up this infrastructure so that in the future we can institutionalize it better. But we need to find those type of solutions to be able to help the small farmers, because they will face significant problems. And this is also linked to financial constraints that we need to help them. Now, one of the problems is how we assure that there is this supply and demand, how we assure the demand side. In countries that have the capacity, we can use e-commerce, and that's what China did. In countries that don't have the capacity, this means the infrastructure in place and so on. And yesterday I was in the Broadband Commission, and right now there is a big push with institutions like the World Bank and so on to try to release the broadband space that we have to be able to increase these facilities, especially for health, but also to be able to create more commerce through electronic ways. So we need to find alternative solutions and ways to resolve this problem, but we shouldn't forget about them because this is an enormous amount of population, of household, of livelihoods that will be destroyed, and their harvest this year will be destroyed if we don't take care of them, and this could create even a bigger problem than what we are facing today. Next, please. Now, the other issue which I was referring is the trade issue. And this is really important, and that's something that we need to look carefully because we cannot allow this to happen. We cannot allow trade restrictions because that will create a crisis, a food crisis where there is no food crisis. And again, the major message here is let's give the correct signal on the logistical part so that we can resolve this problem. And these are, again, a set of measures that we learned from the food price crisis, how we can protect countries, how we can protect our economies. For example, the import part will be more expensive because of the devaluation. One option is to reduce import tariffs, especially for the most vulnerable countries. But what we shouldn't allow is to create a mechanism of export barriers or export bans or export restrictions in any form. On the contrary, I think in the case of Africa, for example, and it's happening in Latin America, is a huge opportunity to assure intra-regional trade, what we don't do today. So Africa, for example, has agreed to do inter-regional trade, but it has not been yet implemented at its potential. So it's a great opportunity to empower that and to reduce the physical distance and empower regional trade. Next, please. This is just to give you an example of what is happening in Europe and all the lockdowns and restrictions and how this could affect all the mobility, especially of fresh fruits and vegetables. Because of the mobility, the closures of airports, the closure of transportation mechanisms. We're trying to expand this to the world, but this shows something that is pretty alarming in the sense that it will be difficult to move commodities. But that's why governments need to very, very precisely focus on certain food value chains and assure that the health measures are there, the testing is there, the distance is there, the physical distance, so that they can keep moving and operating. Next, please. And here, what I want to show you is the different types of markets that this is done by Rabobank. But look, this is the case of beef, how interconnected the beef market is. So this is a sector which is extremely sensitive of what is happening today. Next, please. This is the case of vegetables. We don't see so much interconnection and we see a lot of closer distance. So what Europe is doing, for example, in vegetables, if we look carefully, is affecting very few countries, okay? And that's where we need to look carefully. If China starts to restrict the imports from other countries in terms of vegetables, then we have a problem for the countries that we're supplying. But vegetables is not as complicated as the case of meat. And if we move next, we can see the fruits and vegetables, the fruits market. And again, fruits market is very complicated also. So these are value chain that we need to look carefully at the value chain and see where we can open, where we can operate with the health measures in place. But if we stop the trade of fruits as meat, it will create a big problem. Of course, the staples is similar to meat and fruits. But look at the difference between the different commodities and how different the flow of the commodity is there. Next, please. And finally, we have the macroeconomic implications. And that's something that we need to be very careful because this is what will hit us really back. That's the demand shock side, no? And how we can mobilize resources, especially in the poorest countries. Right now, if you ask me where I need to put the resources in Africa, will be on testing and immediately on finding ways to protect the value chain of food. But testing will be central, the health measures will be central, everything that David was saying. But we also need to see what will be the potential effects after this. And we will see that there are huge potential effects after this. So we need to find ways to be prepared for that and basically to be very, very careful in how we allocate our aid resources. And I think we need to put a red flag here for health. We need to do whatever we can right now. But what else we do with our resources, I think is really important to be careful because we will need all of them and we need to efficiently use them so that we are able to save the much amount of lives that we can. Next, please. And finally, this is just the portal that we have developed. The portal is tracking all the policies that are being made at the country level. It's tracking all the best practices that we are bringing up, not only the ones we have learned in the past, but also the ones we have seen in countries that are already going through this process. It's bringing up policy brief. We have 16 briefs coming up and technical papers to help countries in every topic across the value chain. And of course, the political component on the aspects of trade, which are really important, like this statement between WHO, FAO, and WTO that also was done in the leaders meeting of the G20 and also in the trade ministers meeting. So it's very important to give the message of the information that we have and to assure that in the staple world the supplies are there, but we need to find solutions to the logistical part. So thank you very much, and that's all what I had to present.
Thank you very much, Maximo. Very, very useful, insightful comment on the overall situation that gives, I think, a good overview and understanding for everyone. We understand it is your analysis is targeted also at public authorities and public policies to ensure we limit the impact of COVID-19 on food value chains. I think part of the audience is also made of a lot of operators, and so there are concrete questions coming out of the conversation box. One of them is related also to already lessons learned from China, who has been at the forefront of the COVID crisis. Are there already practical examples or measures taken to overcome the situation? And a special question, especially on the beef production and lower slaughter capacities that were observed in China. Is this expected to happen in Brazil, Argentina, or Paraguay? You showed the map of the meat market that are more complex and will probably be affected. So China and beef.
Yeah, there has been several practical solutions. In case of China, the green basket, that was an idea of before it came up and was useful in the sense of a way of collecting food in higher collection centers, and then the government distributing the food to the affected provinces. But there are other ideas of programs like what Italy is doing, what France is doing in terms of asking their local producers to supply to supermarkets because they don't longer supply to restaurants. They don't longer supply to the services of hotels. So they are trying to help their producers by doing that without closing borders. There have been, in the case of Peru, for example, they have protected the food value chain. So they are locked down for 2 weeks and more now, but they have put a law that allows all the workers of the food value chain to continue moving. The only problem they have is that they didn't have enough testing. And that's something that is changing, but they are protecting their value chain. And that is helping farmers to harvest earlier. For example, asparagus were harvested earlier, and other crops to delay, like avocados, which they can delay, which are key exporters of those commodities. Now, on the logistical side, Argentina was facing a problem. We know that there was a problem in Argentina, especially in soybeans value chain, but then the government immediately reacted and tried to coordinate. The problem was that the provinces were afraid of the trucks moving around because of the health issue. And again, they need to assure that those drivers are tested, that those drivers are using all the health measures to minimize any potential risk. There has to be some logistical revolution in terms of how we do the packaging and how we do the sorting of high value commodities, because the current technology doesn't help for the physical distance that we need in place. So that's innovation that I have not seen yet, but they need to come up, and I assume some of the private sector people in your meeting can help with ideas on that. So those are the examples that I know that are happening, but there are many more. We are trying to list all of them in the portal.
Okay, thank you. So many other questions. I think there is also some of concern about the long-term evolution in the market, and probably paradigm shift or systemic change that may tend to support more to relocalize food production and have more local markets. Maybe it's too early, maybe to tell, but do you see this as a major consequence of this crisis, that the food market would be significantly changed, and probably also with the alternative to meat with vegetables, protein, or other big change in the market?
Yeah, so look, on the staple world, the market won't change because there are 5 top exporters of staple commodities that will continue. There is no, I don't see any. On the high value commodity world, especially on the vegetables world, I think local production will start to be empowered. On the fruits, very complex because of the conditions that you need. And there is no way that countries will have all the availability of fruits. Remember, this is seasonal production, so it's impossible. That's why you need to look at the crop calendars. Now, what is important, I think, is what else we can do. And experiences are, we can bring production closer to urban areas so that we can supply fresh fruits and vegetables. And that's where innovations could have an opportunity, like horizontal farming under controlled environments, which already are profitable, not necessarily vertical, it still is not profitable. The other thing that could be empowered substantially in the countries that have the capacity is e-commerce. No? And that's something that requires some conditions like mobile money, internet broadband access, and so on and so forth. And that's something that we need to start empowering. In some countries of Africa, we can do that. In others, we cannot. In the majority, we cannot. But I think for countries like Latin America, that's an option and that's an opportunity. And the last element, which I think is really important, is that this could be a huge opportunity for interregional trade. What the governments of Latin America are doing right now is that they are coordinating between them to assure that they have a basket of fresh fruit and vegetables available within the region to minimize the physical distance of transportation. Okay? Something similar should happen in Africa, where there's a lot of opportunities. We have done analysis of interregional trade, which are not realized because of the non-tariff barriers. Not because of the tariff barriers, it's mostly because of the NTBs, the non-tariff barriers. So if we are able to empower that, I think it's good. And the other opportunity that I mentioned before is huge collection centers managed by private sector with very clear mechanisms, which today will require some support because of the conditions. But it's a huge opportunity to deploy those and to use the money that is being given to aid in the productive sector in something very concrete that could help to minimize the problems of the smallholders, improve standards, and have a storage capacity both on the cold and non-cold chain. I think it's a huge opportunity to do that, but of course it will require a risk, and I think it's an opportunity to use effectively the resources that are going to be transferred to this country.
Okay, thank you. I think we're running a bit late, so maybe one last question. There are many questions about cash crops markets like tea, coffee, or I mean, in the short run and long run. Maybe there are many other questions on other markets. Sugar, I can see. Maybe it's hard for you to answer all of these questions, but any feeling about this special coffee?
Yeah, look, you're also asking something about the meat and the slaughterhouses, and that's a problem again. A lot of the slaughterhouses are being closed, and there I think, again, we need to look at it carefully and see how we can create the health regulatory mechanisms to keep them alive. On the other sectors, the cash crops, the tea, the sugar, and so on, again, priorities has to be set up, no? So what we need to put in place to assure primary resources of food, I think that's the priority. If a country doesn't have the capacity to handle all the commodities, they will need to make choices, and it's tough, but that's the option. Any sector which is labor intensive will be facing problems, and that's where we need to figure out. And that's also the social responsibility of companies too, no? Companies need to help, and they need to keep their employees, at least for the period of the lockdown until things are settled down. I think it's essential. Companies need to take a social responsibility, especially in the cash crops, where it's a profitable sector, it's a exporting sector, and we need to find a solution for that. And I hope companies are able to help on that.
Okay, thank you very much, Massimo. I think we will move on to the next speaker. Thank you again for your valuable inputs and insights, and we'll share links to your also recent publications afterwards. Thank you very much. I pass the floor to Ninke.
Thank you, Gauthier, and thank you, Maximo. Then we're now moving into session number 3 of this webinar. With this unprecedented situation globally, many of us are looking for experiences. And although, of course, there are many differences in scale and in behavior of the virus, we were hoping that practical insights on measures that were taken, real experiences from the West Africa Ebola epidemic can help inform us and can bring some lessons that can be considered. So we're very grateful to have on the line today the former team of Golden Ferolium Liberia, GVL, which is a greenfield sustainable palm oil operation in a remote location in Liberia in the southeast. At the time of Ebola, it had 16,000 hectares planted and 3,500 employees. So herewith, I'm grateful to announce Matt Karinen, former executive director and founder of GVL, currently working in the investment space and also in a number of consulting roles in the forestry and mineral resource industry. David Rothschild, also co-founder, former CEO of GVL, today businessman active in regenerative agriculture, and also Mr. Vicky Punondarai. At Ebola time, he was responsible as Senior Vice President Operation for GVL in Liberia, and he's currently head of plantations for Wilmar International in Africa, responsible for Nigeria, Ghana, and Cote d'Ivoire, and Uganda. Gentlemen, thank you very much for joining again. Thomas, can you kindly unmute the speakers, and then we'll pass on the floor to them.
Hello, good afternoon. Perhaps my time zone is afternoon, but wherever you may be. So this is Matti Karni speaking. Indeed, unfortunate, or perhaps fortunate for some lessons, our team participated in dealing with Ebola in a rural agricultural setting. So we are here to share some stories, experiences, and thoughts. Ebola was, of course, not coronavirus. There are important differences, and we'll try to reflect on that as we go forward. Certainly, Ebola was a fundamental experience for us. Being responsible for 3,500, 4,000 employees, there are 20 to 30,000 dependents, big families there, and absolute continuity of the operation being necessary, economically necessary for the company and for the people right there. Ebola also killed 11,000 people in a very short space of time. And of course, coronavirus is also doing something like that today, unfortunately. 5,000 of those people were in Liberia. The death rate was 50% of the infected at the beginning. It was a very serious business. I'm happy to say that we did come through Ebola with 0 casualties in our employees, in our families, and in our communities, partner communities. We had imported casualties, but indeed 0 in our own people and their families and their relatives locally. This was not achieved by medical science. There was not enough time for that. It was really achieved by the management, by the operating disciplines, and by the people themselves who took to the actions that we jointly agreed with our employees and with the communities. Now, when I talk here, I did not, of course, myself achieve this result. It was really achieved by a team of people. My co-director, David Rothschild, will be talking here. And especially, it was achieved by our operating people, operating managers on site together with their teams. Vicky is here on the call, but I should also name Mr. Krishna Nalayak, another senior key person who is not on the call today. On that slide in front of you, let me just briefly say, and of course in retrospect, that there were 4 important things that seemed to make the difference for us. Number 1 was early recognition, planning and organizing. I'll talk a little bit more about that. Number 2, relentless communication. Number 3, very specific and evolving on the ground actions. And then number 4, cooperation, meaning don't try to do this alone. Next slide, please. What happened and what seemed to work? So the first thing was really for us early recognition, meaning this is not going to go away. We need to organize. We need to think and act. In our case, luckily, this was before the government did anything. Well, this is probably late advice now that we are in the middle of coronavirus already. Yes, true, but I think this also says for everybody, look ahead beyond where you are today and beyond the next step. What is to come? Be thinking about the next phase now already, perhaps the 2 next phases, whichever those might be in your situation. Do that. We had a crisis team, the 2 directors, 2 or 3 on-site leaders talking daily, and then gradually relax the frequency when we saw that we actually seemed to know what to do. Important element was a threat framework. In some other notions, we might call these layers of alerts, alert levels, green, yellow, orange, red. It was important to think this through up to and including a real catastrophic situation, a die-off, where there would be mass death in the countryside. This was Ebola, just for example, and that would have been a possibility. Luckily, and thanks to everybody, it was not so. We should say this way, have an idea for your threat framework, but really put the effort into the next couple of layers. Those that are not in lockdown, think about how you will operate lockdown, because that may be suddenly announced with just a few hours warning, as has happened in some countries. Those that are in lockdown, figure out how you are going to actually survive when that lockdown may be extended by another 3 weeks or something similar. Raise supply. In our case, it was stocking up on basic medicines and fuel for the operations, as well as food. Our effort here was top down to a degree, but also it's very important to listen to the field. The real decisions are done out in the field by people like Vigi and his colleagues, and only some of them are really done at the board level. And be ready to change plans weekly. Things are evolving, we are learning new things. In Ebola, that was the case, and most likely it's also the case in coronavirus. At this point, let me hand over to David for the rest of the discussion. David.
Thank you, Matt, and hello all. I think, as Matt said, relentless communication is critical. We were working in a very remote area with a very unsophisticated, uneducated, largely illiterate community, very limited access to any kind of social media, etc., and in many cases a great disbelief in what the government was saying. So we needed to invest a significant amount of time communicating, coaching, educating our workers, management included, and also reaching out to the communities with very active, frequent messages, as well as very frequent, as well as materials out there, such as posters, visits to check on the status of community members, and etc. It's very important also with the management team and the employees to put in targets, action plans, and set SOPs in place for particularly for example, dealing with sanitation stations at cordon sanitaire, at giving feedback if things are not working well, and at ensuring that protocols are followed and matters are corrected. It's a repetitive process, as we all know, as we have all been exposed to keeping the 2 meters. It took us a while to learn that you cannot stop doing that. We were running daily musters. In the current context, one would have to think about doing that with distance and possibly structure it differently than the normal way of doing it. What is quite important, though, is maintain the communication and revise as you learn more. Next, please. What's on this slide is really more about Ebola, and it would change slightly for Corona because of the fact of asymptomatic or unsymptomatic or pre-symptomatic people. But we found it very important to put a cordon sanitaire in a number of key places at the gate for all employees coming in. They were checked for fever, they were checked for other symptoms through a checklist. They were tested with thermometer. The staff that were manning these gates all were wearing PPE. And we had a number of cordon sanitaires throughout our various farms. So it's not only in the operations and the offices. We had housing facilities for the employees there. It's very important to get there and put some very strict disciplined actions in place there. Hand washing was and is today, in the Corona situation, extremely important. We provided disinfectant buckets, water treatment materials, etc., and coaching on how to do hand washing to the employees, to the communities. And again, repeat the message, repeat the message. Very importantly, and I think this is relevant to any remote site that has logistics challenges and that has a basic clinic, is it's very important to figure out where the isolation zone is going to be if cases arise, how to protect the clinics how to protect the employees that are operating in the clinics, the nurses and doctors, making sure they've got the appropriate PPE, and very importantly, practice, practice, practice. What's the SOP for putting on the PPE, for taking off, for disposing the PPE, these types of matters. Very important in Ebola because of the high mortality rate from contact, but equally important, I believe, in the current context. And of course, there was a fair bit of engagement with the communities to do very similar kinds of activities in terms of hand washing, in terms of quarantining anybody who shows symptoms, and in terms of really helping the community develop a sense of urgency and mindfulness and preparedness in the case of cases. We did have a couple of cases, as Matt mentioned, of people coming into the communities from the outside. 2 were infected. Both the community of its own initiative isolated them, quarantined them. Sadly, they both died, but the infections didn't spread, and they died because there was no access to medical care, large hospital care in the situation. Next, please. We were a member of a group called the EPSMG, which is the Ebola Private Sector Mobilization Group, started by Alan Knight of ArcelorMittal, who's a big operator in the country. It was basically participants included most of the mining companies in the region. We were the only agri company, but a number of other multinationals. And it was really to provide a coordinated response to the local governments, to support the local governments, to ensure a single voice, a leveraged voice to major players like the World Bank, Médecins Sans Frontières, CDC, governments like the US and the UN. There was a lot of lobbying that was done under a single voice very early in the process, well before many of the people more distant considered this a major crisis. That was extremely useful, the lobbying efforts. Also, there was particular value to information sharing, sharing best practices, sharing materials, and offering each other services. The one very good thing about the EPSMG was the ability to offer, particularly the implementers like the Red Cross, like Médecins Sans Frontières, logistics support in these very remote regions where they were not able to get vehicles, accommodation, food, etc. Similarly, we provided this level of support to the government and provincial doctors with whom we had ongoing coordination meetings. We had constant outreach, and it's important to maintain constant outreach with the communities, the authorities, and also informal associations or committees, both to help them impress upon the communities the importance of the safety and security measures, but also, and the sanitation measures, but also to ensure that we were getting feedback as to any situations that might be arising in terms of possible infections there. And finally, we obviously worked with medical advisors and other NGOs, both to learn from them and not reinvent the wheel, but also to provide them support. Next, please. So I'm not going to go into this here, though it will be in the show notes afterwards, but this slide and the next slide essentially is a little bit more detail, reflecting on these last few points. From an operational point of view, I can just say it's extremely important to check and verify the health of people coming into a site if they're coming from the outside, and to maintain constant checks for people that are on the inside. In the case of Ebola, transmission was much slower than COVID, as we know, and I would suggest that in the COVID case now, one would actually entertain, if you are keeping operations ongoing, a preemptive, try to keep people try to have people maintain social distance within the communities right now, within your on-site facilities right now, and for getting an early warning system in the event that anyone comes back with symptoms. With Ebola and frankly also with COVID, it turns out that that malaria symptoms in the first few days are very similar to what Ebola would be, or in this case, likely with the fever that you might see with COVID. Take it seriously, put people into isolation or into quarantine. Hopefully it's just a malaria. Hopefully they can be treated quickly with medicines, etc. Getting equipment and logistics support to the company is also very important. As Matt had said, the PPE, medicines, etc., become critical, and one really has to stock up in the event of a lockdown. So, in summary, really, I would say, there are obviously important differences between what we went through then and what COVID is challenging people with now. In your planning, do think about how to give particular attention to the high-risk groups, those that are older, those that have comorbidities that are necessary. Perhaps social distancing on a much stricter basis with those people is a good move. And again, education and coaching and support is necessary there. I've mentioned the fever story. Obviously, if the infection gets inside the fence, so to speak, into your operations, you need to have a very clear plan as to how or if you can continue operations. Perhaps it's only in one area and you can isolate all the people from that area, replace it with a SWAT team, or alternatively, you may be forced to slow things down or shut things down. And then importantly, early in the game is to do planning, as I'm sure most companies are doing these days. Plan for the economic impact and the operational impact. Matt had talked about the escalation matrix or the threat identification matrix. We found that extremely useful because each level of the matrix had a whole bunch of actions that were well communicated through the management team, and anybody, and every time we had to move from one level to the next, we were ready for it. And particularly in the concern of lockdown, as would likely be the case in many situations here, is you should have preconceived plans, pre-prepared plans to help you deal with the crisis when it hits, because it's likely to hit quickly and hard. Similarly, the how to get out of jail plans is, as restrictions are lifted, whether they be internally generated by the company or by the government, is how to get back to normal operations. Useful to do the planning quite early. So I think that would be our experience in a very brief summary, and our thoughts on it. Happy to take questions, and thank you very much to IDH for inviting us to it, and Mirova for inviting us to participate in this.
Thanks very much, Matt and David, for these very practical pointers based on your experiences at the time. Looking through the questions, I think there are a number of questions that really look at the practicality of the measures that you were taking and how they were implemented on the ground. As you reiterated, important to check regularly with the community. Could you maybe share some insights on how you made sure that measures were understood and respected by people? So day-by-day quality management.
Perhaps Vicky is on the line, and Vicky, could you comment, please?
He may be on mute still.
Vicky.
Most of workers, you can hear me now?
Yes, loud and clear. Yeah.
Most of workers come from the communities, because in the early stages of development, you don't have accommodation for the workers staying there. And most of them like to stay in their communities with their parents and then their social structure. So when they come early morning to work, we make sure that we all are tested. Example, where early morning they walk, there are 8 lanes ready for them to walk in. When they come by the bus, they get down, they walk the 8 lanes. And there are the senior nurses and the trained medical staffs and the EHS or staff are waiting there to take to see them. They're washing their hands. There's a big Bowser with about 4,000 liters with 10 taps. So each lane go and wash their hands and go to the next step to get the temperature taken. Anybody with a temperature more than normal are sidelined and put in a waiting camp there. And once this is completed, all the workers go to work. Those who are in the waiting camp are tested and further details are asked. Any disease among their communities, all those things. And then the doctor comes about 8 o'clock and does a thorough medical checkup before these workers are left to go to the field and work. We are worried that these people may be meeting other Ebola patients in their community, and these people transmit to our workers, and when they come to work, all of them get the same disease later on. Once the doctor feels okay, they go to work. Otherwise, they're taken to the Greenville Hospital, where they are stationed there and quarantined for 21 days. Again, daily checks. Importance is PPE, disinfectants, Dettol, face masks, and other items must be available in our rural settings there. Absent workers on the previous day or days are told to wait in a waiting area. These workers are checked by the senior nurse for any symptoms. Unless satisfied, they can go to work. If not, they are sent to the government hospital for further checks, because we are worried they're absent because they had a high temperature or fever. They didn't come to work just because of Ebola. And this can be same to the COVID also. Then how did we educate our communities and all those things? The managers, field supervisors, gang leaders are trained first of the infectious disease. Training is done by the nurse and the environmental health and safety staff and the in-house medical doctor we have. The most important and difficult part is the community leaders and paramount chiefs and clan chiefs are invited for a meeting for discussion and how we tackle Ebola outbreak or same with COVID. Once these influential leaders agree upon this discussion, they go back and talk to the community setting and dependents and how to seek medical treatment from us. In fact, when we were operating this greenfield structure, we had also taken over the medical examination and medicines provided to the communities surrounding our estates. We took care of the midwifery and vaccination on infants and children. One of the toughest jobs we faced was because they don't believe in the Western medicine. Therefore, these are challenges we faced there. Workers refused to follow guidelines given. And food was difficult because they can't go and do their farming, and food became scarce. We had to supply the food. Expectant mothers do not isolate themselves, so they come in contact with the infected people with the disease or same with COVID. And it's very difficult because sometimes the newborn are infected the same day. That's a very difficult things we had. And then when a funeral happens, it's a custom or some tradition that they keep for 1 week before their relatives from other rural areas come in. Therefore, but now with Ebola or COVID, they have to bury the same day. So they can't take that type of the new movement to this type of against the traditions. And we have a tough time explaining to them, and can't open the body. It's all sealed up in bags and they should bury it immediately. And again, more believe the African traditional medicine than Western medicine. It takes a lot of time for us to explain to them. I must say the medication by our nurses, which are time consuming, but at the same time, our nurses were overstretched to going to the villages and communities, explaining to them and taking care of these community dependents. Yeah, that's it.
Can I add one thing to that very quickly? Is that we worked with an international medevac company that we were partnering with, which we basically worked through the standard operating procedures for each phase of exposure to dealing with the cases. So, for example, what is the standard work? What would their recommendation on the standard operating procedure for a gate post, and Vicky gave good details on how those were implemented. So we had, we had professional guidelines from, we paid for it, of course, but we had professional guidelines from medical specialists as to how to handle the gates, how to handle putting on and taking off PPE, how to handle the isolation centers, etc., etc. Obviously, the implementation is about good management and repetition.
Great. Thanks very much, David, Matt, Vicky. In the interest of time, I'm going to try and summarize the questions that we're receiving into a final question. There are a number of questions that come up looking at very practical issues, like how to deal with camps, how to deal with transporting workers, then in workers' accommodation. Maybe in any final remarks, is there any practical experience that you can share on that level, or maybe any closing words that you would like to share?
What we used to do in the, we transport workers using buses, and every seat can occupy 2 or 3 workers to the work. But with Ebola and the same to COVID, we are doing now, practicing is, the one worker occupies the seat at the window and the other at the window. That means we are doing more trips, 3 to 4 trips a day instead of 2 trips, doubling the trips, to reduce the contact or keeping the distance.
Yeah. Very good. What we could also do is, if there are practical questions, Nienke, you might want to summarize those, and we could perhaps go through those together with Vicky and other colleagues and try to give some more practical advice in a follow-up. Not in a new call, but perhaps in a written set of notes.
Will that be really helpful? And to the participants on the line, we'll keep the line open and the chat function in the half hour following this call, so that you can type in any additional questions or recommendations to this team. With that, let me then thank you very much, David, Matt, Vicky, for your valuable contributions. And we'll move on to the next part of the session. We're really grateful that you were able to join us today and share these practical insights.
Thank you.
Thank you. As we're running a bit behind on the schedule, I'm going to already announce, make a small announcement before the floor to 2 companies that will briefly share practical measures that they're taking related to COVID-19 at this moment. After their presentations, we will open up a poll in Zoom, and we will invite your feedback on this webinar. But more importantly, we're also trying to use this platform on behalf of a bigger group, including partners like Proparco, FMO, and like-minded organizations of IDH and Mirova, to get a better understanding on how we can further support you. So our chat function is open for these 4 questions that you see on the screen currently, which are, in a few words, reflections on this webinar. Question number 2, should we organize a similar webinar? What can we improve? And question number 4, also very important, what do you anticipate to be your main COVID-19 challenges in the coming months? And how can we, organizations like IDH, Mirova, further support exchange of information or provide other types of support? As mentioned, this is not only for us, we will be compiling the information and sharing it with like-minded organizations. We decided not to send out a survey after this call, but really leave the line open for you to share your views, your needs in the chat function. And if you don't want to share all in the chat function, you can share a private message with Thomas Duurland. And of course, when we share this information with other organizations, that all will be shared on an anonymous basis. So thank you very much for helping us understand better how we can support any follow-up from your end. With that, I'd like to move on to session number 4 and give the floor back to Gauthier, who will announce the next 2 speakers.
Yeah, very briefly, thank you, Nienke. So now for this last session, we wanted to really give the floor to 2 operators on the ground and give them first the opportunity to share also the measures they are taking on the ground to adapt to this COVID crisis, and second, to provide feedbacks and share specific challenges or ideas on how organizations like us can support, and also comment on earlier speakers to make it as live and dynamic as possible. So I would like to give the floor to Tatiana Pajon, who is Chief Country Officer at Forest First Colombia, which is a large-scale sustainable plantation forestry company founded in 2010, and that has already implemented on the ground actions to adapt to the crisis. Tatiana, in 5 minutes, can you share the actions you're taking and feedbacks on the discussions we've just had?
Good afternoon to everyone, and thank you very much for the introduction. We operate in Colombia, and for us, COVID-19 just came about on the 6th of March, and as of last night, we closed with 1,000 cases. So perhaps the spread has not been as large as in many other geographies. So effectively, what we have done is implemented a containment strategy, very much in line with some of the comments the previous speakers were providing us with in terms of help. So we operate in a very, very remote location. We operate in the eastern plains of Colombia, very close to the Venezuelan border. So we also have another dynamic there of potential spread through cross-border contamination. The country of Colombia has implemented a full lockdown as of the 25th of March. So it's relatively, we've only been for a whole week in a lockdown scenario. Having said that, prior to the lockdown, we already started implementing our own version of lockdown, primarily looking to diminish or avoid at all contamination within our operations, but more importantly, within the local communities. Because of our remoteness, we have very limited capacity of infrastructure services, health in particular. So we could be, as a company, having people rotating, coming in from other parts of the country, in and out into the rural areas. We could have been a very significant focus of bringing the disease into the region. And with that responsibility in mind, we decided to implement the following measures. So the people that were out, people can come in and out of our operation. So from a rotational point of view, as we call it, those who were out on rotations in the major cities or other parts of the country that could already start experiencing COVID, we've asked them not to return, which puts operational pressure and meant that we had to redesign our operations and our businesses so that they could be conducting other type of activities in case there were purely operational staff. By that I mean in the field, checking and working with people in our plantation. So that has made that our management staff has to relook at how to redistribute work and how to give legitimate work to those that we asked not to return so that they could be in a remote working capacity. It's put a lot of pressure on increasing our communication ability in the field, and by that I literally mean bandwidth and so on, to allow people to be in better communication as they're not now contiguous to each other. In terms of our camps, our nursery has people coming in and out of the community, and the rest of the staff is based out of camps. I've noticed there are a few questions around that. So with the community workers, what we've identified is a minimum number of staff that can be working. So we reduce, as an example, in the nursery, we used to have an average 25 people coming in and out on a daily basis. We've identified the minimum number of staff that could keep the operation in the nursery going, and we've allocated and redesigned some accommodations so that they would be in the camp, and then we would have the remaining people outside of the camp, and we're rotating the staff. Obviously checking at daily temperatures. We have provided everyone with kits in terms of mask, hand gloves, and sanitizer, and we have operational procedures so that they're washing their hands on a regular basis and monitored. And then the camp staff, they're being mobilized in and out of the operations into the plantation areas, but without moving into any other locations where they could contaminate. The hardest challenge for us has been logistics, because it's a very remote area. Communication internally and with the stakeholders and communities has been critical, because on one end, we experience the fact that people are not well aligned with, or they haven't yet learned what's going on at a macro level in the country. And that sort of creates a sense of panic. So it's been very important for us to communicate regularly with facts about what measures government is taking. On labor law in particular, we've been using, the government has allowed for people to go on leave in advance. So we've been trying to use the leave capacity to be able to have some people in and out of the operation. So a lot of communication to our management, our team leaders and our staff, but equally with the community leaders. We have regular meetings every 3 days. We have people from our operations speaking with the community leaders so that they're aware, because lack of communication also creates a lot of panic. So the initial reaction was no one can come in and out of the community. So by working with them and informing them about the measures, we've been able to effectively keep our operations working at a full capacity. We've also implemented a number of incentives, because those people that are in sort of, that could not take their rotation, in other words, they could not take their leave. We've been asking now people to be for 3 months or more, because we don't really know the entire length of the lockdown. So we've created a set of incentives that incorporate a mixture of financial incentives, but also potential leave that could be taken at a later stage, so that people know that if when they're in, they can then compensate that time, and the stress, of course, of being in, not knowing exactly what's happening with the families, and being a little bit out of tune with what's going on in the rest of the country. So just in a few closing remarks in the interest of time, what we've learned, very much in agreement with what has been said before, is anticipate what your operational procedures can be, but equally keep a flexible mindset, because this is an ongoing change. At a governmental level, new things are happening daily that will have an effect on our operations. So we need to keep flexible. Communication, it's been critical on a regular basis with our staff, providing information that is practical as to what to do in the case of. So we've been doing a lot of that, keeping more than regular meetings with our management team and team leaders, so that they're informed as to what's going on in the rest of the country, what measures are coming about, and what we're likely to do or not, and also keeping in touch with what's going on in the field. So keeping that feedback circle, so that whatever decisions we're making, it's commensurate with the reality in the field. And a lot of articulation at a macro level. So we're working with the rest of the agricultural sector, but equally with the local government, to make sure that we're all in coordination, and that any measures that are taking are not sort of counterproductive to what's going on with the communities or with our own staff. So those are basically the steps we've taken, and I appreciate sort of all the information that was shared from the previous company in a much critical crisis, because it is really helpful to see practical on-the-ground experiences that one could implement and adapt to one's reality in operations. So thank you very much for inviting us.
Thank you very much, Tatiana, for your feedback. Very useful as well. Now, also for sake of efficiency, I'll give the floor to the next speaker to also share views, experience on recent COVID developments. And so I give the floor to Kate Mathias, Compliance Director within Mirova Forestry, which is a sustainable forestry operator active in Ghana and Sierra Leone. Kate, the floor is yours.
Thank you. I'll try not to repeat too much on what other people have said. Basically, we operating in the two countries, we've been guided somewhat by the changes by the government, and for example, with our expatriates working there, because the governments of those countries, particularly Sierra Leone, closed flights quite very early on. The expatriates were given the option, if they wanted to leave, they could and work remotely, or if they were willing to stay, then they would stay. So that was kind of a forced hand because of flight cancellations. And we moved very rapidly into awareness raising within the communities by our social teams and also our nurses, and also with the help of other companies, particularly Ilova Sugar, we developed some posters and leaflets for the notice boards and for the transportation to be able to raise awareness on an ongoing way with the communities. We've also within Sierra Leone, where we have regular radio slots for our social communications with communities, those have also been used to target the awareness raising on COVID-19. On a more practical basis, as we've sort of moved forward, and this really is very much changing all the while, even this morning now talking with the Ghana team, particularly where the situation seems to be moving more quickly. We're looking now at what operations do we have to close down, what operations do we have to suspend. But in the first place, on the prevention side, we implemented increased hand washing and sanitization across all areas of the operation, including at the locations where people board transportation. So before people board transports, they have to wash their hands, and that's provision of soap and chlorinized water for that. We have implemented the reducing the transportation load, so also the one seat in between the workers. We've tried to reduce the amount of movement of communities into different areas. So we're trying to have communities working on the plantations or the compartments closest to their area where they live, to reduce cross-contamination between communities. There's been washing of the vehicles in between journeys, and of course this has an impact on the efficiency of the operations because it takes a lot longer to get people to and from work. We placed a ban on meetings and travel by non-essential travel outside of the operational areas, and also we very early on suspended any non-essential work streams, reduced meetings with communities, reduced large-scale meetings or banned large-scale meetings, and tried to move people where we can into a remote working situation. We're now kind of moving now rapidly, particularly as I say in Ghana, into the sort of enforcement side. We've produced today our sort of public document for our workers and for the communities around that really detail what happens now when we start to suspend or close operations, and what happens to people when it comes to pay, when it comes to leave. We're looking at, as most companies are, utilisation of accrued leave to start with, then potentially moving on to 50% pay, dependent on the duration of the lockdown. We are going for very much a sort of choice to work situation. There are certain activities, for example, the industry activities where we cannot enforce distancing, where they are going to have to be suspended. But in other areas, we're advising workers who have pre-existing health conditions not to come to work. We're advising our older workers not to come to work. And then we're also offering the opportunity for workers who feel particularly worried or anxious about the disease not to come to work, and asking them to advise their line managers whether or not they'll be coming, so then we can work and look at what activities can we undertake, what can we continue to do with the resources that we have. Obviously there are key teams that we need to retain skeleton staff for, and we're just working through that process right now, and we will be, as I say, publishing that document later today for both countries. So it's like everywhere else, it's a very fluid situation. You're just trying to manage the best that we can, but ultimately the health and safety of the workers and the communities is priority over the trade. I think that's it, really.
Okay, thank you very much, Kate. And there are a lot of common denominator, common measures taken, and it's good to see so many examples to also give some help to anyone around this call to maybe get inspired from what others are doing. Ninka, would you like to make the closing remarks?
Yeah, thank you very much, Gauthier. As closing remarks, of course, first of all, a warm thanks to other speakers that were able to join us today on this very short notice. Also, warm thanks to our partner Mirova and to the team at IDH that supported this organization of the webinar technically. And of course, finally, a warm thanks, and we wish you all very well as all the participants on the call today. I would like to also now open up the poll. My colleague Thomas will open the box where you can share more binary evaluative input, but please use the chat function, because we were trying to think of questionnaire type questions, but those require that we already know the answers, and to be honest, we don't. So share with us what is keeping you busy, what would you expect from organizations like us through the chat function, and we will make sure that words get spread. Then two final remarks. First, for investees of FMO, right after this call, a webinar is being set up especially for you to interact with FMO and also provide recommendations to FMO. So FMO clients, please look at the chat function and see the link to the webinar, and it should also be in your inbox. And then, as a final word, I would like to let everybody know that this webinar was recorded. It will be shared with you. We are targeting tomorrow for sharing the webinar as well as a short report. So feel free to forward this to colleagues, co-workers, supply chain partners, other people, stakeholders, to spread the word. And with that, I think we would like to close. So again, thank you very much. We'll keep the line open, as said, for another 30 minutes for you to be able to share the chat functions. Stay safe, and with any recommendations or views, please get in contact. Thank you very much.
Thank you. Bye-bye. Bye, everyone.